I've spoke before about the concept of open room adjusting. It's not for everybody, but it's really, really efficient, and it's wonderful because of the patient interaction. Here I have patient Yadira, who's wonderfully given her consent to me showing an example of how I talk at the table when I'm adjusting patients. So, hi Yadira, it's good to see you.
Hi, Dr. Burns.
Let's check you. You're doing much better up here in your upper thoracic spine. And I know you mentioned that you're back at the gym now for the first time in 6 months, which is awesome.
That's right.
So happy for you. The subluxation we're going to focus on today is right here at the T5, T6 level. These are the nerves that control into your stomach and upper digestive system. So we're going to continue to keep your progress going. Exhale your air out. Beautiful. Very nice. Yeah, overall, I'm pleased to see your progress after just a few weeks of care. We have a subluxation here at L5 that controls your legs, feet, and toes, also lower digestive system, bladder, urinary tract, and reproductive organs. So I'm going to work there today some more. I'm going to have you turn and face me on this side. So for this correction, I'd like you to just exhale your air out. Very nice. Okay, now flat on your back. So we are going to follow up with this upper cervical subluxation and continue to take the pressure off of your brainstem and just relax your left shoulder and arm. Very nice. Okay, excellent. Sit on up and turn your legs around this way. So really happy with how you're progressing. We have your first re-examination, Yadira, coming up in only 2 weeks, so I wanted to remind you of that. And as you know, we track that in our system. On that day, allow yourself about an extra 10 minutes because we're going to review the test that we did on you when you first came in. The whole idea of that is to check your progress, make sure everything's right on track. But so far, so good. I'm really proud of you. Your next adjustment is on Friday, and that's at 3:10. We'll see you then. Keep up the good work.
Thank you.
You bet.